To Gaza now, where Israeli fighter jets have attacked a floor of a hospital in the north of the Strip, where medical supplies delivered by the World Health Organization 5 days ago were being stored. The Kamal Adwan Hospital in el-Balah has been struggling to provide medical assistance to an increasing number of people injured in Israel's assault on the north of Gaza. Let's bring in Tareq Azzoum in Deir el-Balah, central Gaza for us. Tareq, the Kamal Adwan Hospital targeted once again. Bring us up to speed with the latest on the situation in Northern Gaza.
That's right, Folly. Kamal Adwan Hospital, which is one of the last remaining functional hospitals in Northern Gaza, has been again targeted by the Israeli military. As far as we know from medical officials in Kamal Adwan Hospital, that a floor containing the remaining medicines and medical supplies was targeted by the Israeli artillery with no sort of warning. As far as we know, that there has been a very significant damage being resulted from the attack, especially on the pharmaceutical warehouse and what has been left of medical supplies there in that hospital, which will incredibly hamper the ability of the hospital to operate, even with a very limited medical capacity there. And also we've heard from Dr. Hussam Abu Safiya, the director of Kamal Adwan Hospital. He said that the situation in the hospital is getting much more worse, especially in light of the unprecedented Israeli scaling of attacks on the vicinity and on the hospital itself. And as far as we know also that the lots of injured people have been really dying on the way to the hospital after being reported injured from the Israeli airstrikes. And he also emphasized that the attack has really injured 4 people who were inside receiving medical treatment, and also it rendered the dialysis department out of service there, which will have further repercussions on the conditions of wounded and patients there who are till now did not receive any sort of essential medical supply. The situation is getting much more worse in the northern part of Gaza, but the real question is why Israel is still banning the flow of medical supplies to that hospital and to provide that area with enough numbers of civil defense vehicles there in order to save the lives of Palestinians in that very disturbing part of the Strip.
Thank you very much, Tareq, for the update. That's Al Jazeera's Tareq Azzoum reporting there live from Deir el-Balah. Well, let's speak to Dr. Tanya Haj-Hassan about this. She's a paediatric intensive care and humanitarian physician with Doctors Without Borders, MSF. Dr. Tanya Haj-Hassan has made several trips to Gaza in the last year and is joining us from Amman. It's good to have you with us, Dr. Tanya, on Al Jazeera again. So you have here stores of medical supplies which were delivered by WHO just 5 days ago, completely destroyed in the only medical facility which was still able to provide some care in northern Gaza. What is your reaction first when you hear this?
I mean, the first thing I just want to clarify that I'm not speaking on behalf of Doctors Without Borders today, although I'm sure they would share very similar things to what I'm about to tell you right now. I was last there in March. Kamal Adwan is one of the few remaining functional hospitals in the north of Gaza. In the words of the director, Hussam Abu Safiya, who's there at the moment, he's actually one of only 2 doctors that are left in that hospital. He said, what is happening here is catastrophic and true genocide. And you know, it's really difficult to imagine what it's like to be a doctor in that hospital right now. 2 pediatricians, mass casualty arriving after mass casualty. Normally in a hospital, you have multiple multidisciplinary teams, subspecialties, you have surgeons, you have anesthetists that are required to put the patients to sleep and keep them safe during the operation. You have different types of surgeons that operate on different types of injuries. And all of those things were present in Kamal Adwan Hospital. But as you know, it has been targeted multiple times. It was invaded just last week. Numerous, estimates of approximately 30 of its staff were unlawfully detained by the Israeli military and taken away. We don't know what their fate is at the moment. Leaving behind just 2, and this was after, stripping them and reports of torture, and leaving only 2 pediatricians behind, one of whom is the director of the hospital, whose son was killed during the invasion of the same hospital, of Kamal Adwan Hospital, just last week. So you have 2 pediatricians that are caring without supplies, and we'll talk about that in a second, for mass casualty after mass casualty. Just a couple of days ago, Hussam al-Safiya was talking about more than 55 wounded arriving at once, along with more than 25 killed people at the hospital, casualties all over the floor. He mentioned women and children that had open fractures with protruding bone. So the bone coming out of the skin, you need surgical support for these sorts of injuries. Pediatricians are not going to be able to manage them on their own. They need surgical support. He described just today penetrating shrapnel, so shrapnel through the abdomens of patients, including children, that require life-saving surgery to stop the internal bleeding as a consequence of that shrapnel, bits of the weapons that are used and of the buildings that are destroyed, that are propelled and penetrate the bodies of people in their vicinity. And so he mentioned several of these cases dying on the floor of the emergency department because they do not have subspecialty services. They don't have physicians after they were abducted and detained. And now to hear that once again the hospital has been actually hit is really inconceivable, Foley. It's inconceivable. Just last week, they targeted the oxygen source of Kamal Adwan Hospital an hour after the WHO-led Joint Commission left the hospital following the delivery of a small amount of medical supplies and fuel. And then today, they target the same space where these medical supplies were left, including, if I heard correctly, they damaged the desalination place near the hospital as well. These are all things, these are not military weapons. They're not strategic in any military capacity. What they do fully, and I think it's really time we start talking about this, because you and I have been speaking for over a year about what is going on and what is very clearly genocide. There is no way to rationalize the repeated targeting of every single hospital in the Gaza Strip.
So do you think, Dr. Tanya,
to rationalize that.
Do you think, Kamal Adwan, not the first time, as we've said, but it is not the only healthcare facility, the only hospital that's been targeted time and time again by the Israelis. Do you think there's a deliberate strategy here by Israel to decimate Gaza's healthcare system?
I have zero doubt about it, Foley. Zero doubt. I mean, I don't think there's any other way that you can explain this. There have been over 300 healthcare workers that have been unlawfully detained, with those released reporting torture. Over 1,000, according to the Ministry of Health, and we have confirmed at least 600 of them through communication with their families and other means. Healthcare workers who have been killed by the Israeli military so far since last year. I'm just talking about the Gaza Strip. I haven't even started talking about the West Bank or Lebanon. And, when I told you, I think it's important that we speak very clearly about what's happening. What the Israeli military is clearly aiming for is the forced expulsion of the Palestinian people, no matter what the cost, including their ethnic cleansing and their genocide. And that has become very clear as they have, and I came on your program multiple times before and spoke about very, specifics of what was hit and where, and trying to get aid in, and really towed the line of let's talk about getting aid in and let's talk about a ceasefire. But I think we need to change the way we're having this conversation, because it is very clear that after over a year of this, back in January, we had plausible genocide from the International Court of Justice. And over a year of this, and we're still hearing justifications and very misleading reporting from many media agencies. And I thank you, Foley, for not being among those, and for maintaining the integrity of journalism that has been really lost in mainstream media, along with any kind of respect or adherence to international humanitarian law.
If we change the conversation, as you say, Dr. Tanya, what will that achieve? Do you think it's going to make a difference?
I don't know. I don't know fully, honestly. I don't know what will make a difference at this point. I think the reality is my colleagues in Gaza have been working in the hospitals for over a year now, day in, day night, as their family members are genocided, as their colleagues are genocided. They treat these horrific injuries that me and my colleagues who've gone for just weeks come back traumatized from witnessing. I cannot imagine what it feels like as a Palestinian healthcare worker right now, screaming into a void, caring with limited resources, as your healthcare system's been decimated, as you're targeted just for being a healthcare worker through deliberate killing and abduction and torture, and to watch not only the international political community, because we know the international political community, we've seen this in conflict after conflict, often follow their own strategic and economic interests with complete disregard for human life, particularly when that human life is not of their ethnicity or background. And there's a really inherent racism in that. But particularly, I cannot imagine how they feel when they watch their healthcare workers internationally and the societies and organizations whose goal is to represent healthcare workers stay silent on a deliberate and systematic targeting of healthcare and healthcare workers for over a year now. And I can speak about children and healthcare workers. I'm sure you can bring on in many people who can talk about ecocide and scholasticide and the destruction of all the universities and multiple schools. But I cannot. I have one message, and I've left many messages for people on every media opportunity that I have. But for healthcare workers globally, if you have not spoken up about this, I urge you, I beg you to speak up about it. And I also question the credibility of any healthcare worker who can silently watch this unfold or who can justify the deliberate targeting of healthcare infrastructures and a civilian population for over a year now.
Dr. Tanya Haj-Hassan, thank you so much for talking to us. Thank you for sharing your message with us.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.